folks, we are back. This is the Ethnic Health Disparities Podcast Show. I am Dr. B, and welcome back. This is show number 12. And yes, this is part 2 of the CDC report, Racial Disparities in Age-Specific Mortality Among Blacks or African Americans, United States, 1999 to 2015. This is part 2, and we may have part 3. I am still smoking over this report. That is, I'm just blowing up. Over this report. And yes, it is remarkable. And now this show is flipping what is reported. Flip it over. That is, turn it over. Turn it over from the generic mainstream report coming from CDC to the perspective of, guess what? The population, African Americans, and what is remarkable of this data. And I'm going to give you an understanding why it's so important to flip these reports over. That's coming from, one of the most significant agencies in our United States, CDC. Again, I love CDC, and because I spent time there, and I understand the reporting, the structure, the dynamics of it. But before I go on, yes, please email me at ejb678@gmail.com. Subscribe to our podcast. Let me just say, we're just blowing up on Instagram. I love the response from my Instagram followers. Whenever I send out the Ethnic Health Disparities podcast show of a new podcast show, please just listen to one of the shows. But my Instagram audience, thank you so much. Facebook audience, they're right there. Just listen to I got my Twitter audience. It's fun. But again, I'm on iTunes. Baby. Yes, iTunes, Spotify, Podbean, and YouTube. So there you go. That's the set. I'm 2 minutes, 30 seconds in. But this report, let me slow down, is so powerful. And I don't know how many shows. I may have to do several, but officially I'm doing 2 shows on this particular report. Again, this report comes from May, and I want you to read this over yourself. Hello, general public. May 5th, 2017. From the Morbidity and Mortality Weekly Report of CDC. This is the voice of CDC, and this is a series of publications, reliable, authoritative, accurate, objective. And these reports usually are viewed by physicians, nurses, public health practitioners, epidemiologists, and other scientists, researchers, educators, and laboratories. But I'm translating this information to the general public. Hello. So in the last show, I highlighted the remarkable declines in all-cause mortality rates from 1999 to 2015. The mortality decrease among blacks, 33% in 1999 to 16% in 2015. Drastic declines in heart disease, cancer, HIV, cerebrovascular disease. And there was actually, in 2010, a crossover in death rates, beginning in 2010 when blacks had lower death rates than whites. Wow. So, in this show 12, what I'm going to show you, this is how they missed it. After all that important information that I just shared with you in show number 11, here's how the continuation of this report. After they indicated the drastic declines, here's how they, and I say they, mainstream, report the reporting. They said, however, after that great piece of information, again, from anyone's perspective, and particularly from the African American community and the African American researchers like myself, that's phenomenal. That's earth-shattering. Declines. And then they say, however, despite substantial reductions in death rates among blacks in the United States. Blacks continue to have higher death rates overall, higher prevalence of many chronic health conditions and lower prevalence of some healthy behaviors. Blacks were less likely to participate in leisure time physical activity and maintain healthy weight. Blacks were more likely to report not being able to see a doctor because of costs, even though across age groups, the percentages of blacks and whites who reported having a personal doctor or health provider were approximately equal. In addition, this analysis showed that blacks had significantly lower educational attainment and home ownership and almost twice the proportion of households living below the poverty level and unemployed than whites in all age groups. What does that say? They immediately, and I'm not pinpointing the researchers per se. Hello. But you go back to the same type of reporting, the same type of differences between blacks and whites. That is, showing that less likely to have physical activity, less likely to maintain a healthy weight, more likely to report not being able to see a doctor, significantly lower educational attainment, and home ownership. Those are trends, and that tend to be over-reported again and again and again. And yes, they go to the fundamental causes of address this issue, and yet they don't say, now here's oh my gosh, here's what they continue, and they further state and say these findings are generally consistent with the reports that use the term weathering to suggest that blacks experience premature aging and earlier decline than whites, and that this decline in health accumulates across the entire lifespan and potentially across generations as a consequence of psychosocial, economic, and environmental stressors. And then it mentions some strategies to overcome this. The Community Preventive Services Task Force, the U.S. Department of Health and Human Services Action Plan to reduce racial and ethnic disparities, the racial and ethnic approaches to community health, the REACH program, But they didn't go into detail. Just back it up a little bit. When you mention the consequences of psychosocial, economic, environmental stressors and the weathering issue, this is the impact of racism. Hello, they just missed the term. They wouldn't want to mention that, obviously. I wonder why. Because that's what the community is always thinking. And now in 2019, we have significant data to kind of document that, yeah, this is racism that's happening when you bring up poor life situations impacting health outcomes, the impact of racism in our society. Now, you could have mentioned that, but you didn't. That's disappointing. You know, you're right there. Go ahead and say it. Yeah, and see, this report is very significant because what it is the reliable, accurate, and objective and authoritative voice of CDC. And I'm encouraged. Yes. I'm not even. I can say this. I can say this. Come on, CDC. Take the next step in this Morbidity and Mortality Week. Say it. Use the words. Document it. Because you are the authoritative agency in reporting this accurate data, timely data, objective data. So be objective and say, put things together and start using the words, the significant words that each community, not just the African American community, but the Hispanic Latino community, the Asian Pacific Islander community, the American Indian Alaska Native community, all health disparity communities. All health disparities communities. are saying this, are recognizing this. And in 2019, we're starting to have much more data to support that these multiple issues are the result of institutional racism. That's one element. And we talked about this in an earlier show. Hello. That's the reason why I do these shows. So I'm not pleading with CDC. I'm just saying, CDC, take the next step. Stop being so comfortable in reporting the expected data, the negative data that's happening among various racial and ethnic populations. Start reporting the positive data. That's what I'm getting to. Report the positive data. This report could have been titled, Examine the Significant Decrease of Death and Morbidity Among Blacks in the United States. But they didn't do that. They just titled it, Racial Disparities in Age-Specific Mortality Among Blacks or African Americans. Could have been titled much differently and received much more notoriety. I had to dig through this. And this data is earth-shattering. Earth-shattering. With drastic declines like this should be front page news. This should be on every leading report, health report in the United States, on every major national news network. But we overlooked it. We purposely, yes, I said it. You purposely overlooked it. That's not good. Why? Because every group needs some positive data. This helps the general population as well. Because therefore we can start asking the next question, what positively happened? What in a positive way happened among blacks from 1999 to 2015 to have such drastic declines in heart disease, cancer, HIV, and cerebrovascular? Something positive happened. Some federal programs supported and provided positive outcomes for African American blacks from 1999 to 2015. Some positive, whatever positive programs across the United States occurred. And everyone can learn from it. Hello, this is a teachable moment. Hello, CDC. Hello, my colleagues, my former colleagues. Yes, my former colleagues at CDC. And my former colleagues at NIH who are doing an outstanding job. Let's dig a bit deeper and let's start reporting positive data when we have it in our data sets. Hello. When we have it in our pools of data sets. And you know what I'm talking about. So this is tons of data from 1999 to 2015. And I'm going to do another show. There might be 2 more shows on this. On just this report. I cannot just do 2 shows. I couldn't do 1 show. I can't just do 2 shows. I'm going to drive this report home. This is, again, let me repeat this. Morbidity and Mortality Weekly Report. CDC. The Voice of CDC. Published May 5th, 2017. From pages 444 to 456. You can pull it up. It's a team of researchers. And again, doing my homework, I was shocked that this had been reported and no and the title was not indicative of the data. And they fell right back into the trap of reporting negative outcomes. Wow. Don't you think every ethnic population is so tired of being in a lesser than health status than the general population? Hello. There is something positive occurring now from 1999 to 2015 and still going on in 2019. Something positive is happening. And we're going to break out what potentially could be some of those issues. Hello? That's the next step. What are the major factors which have led to the decline in heart disease, cerebrovascular disease, HIV, and cancer in the African American black population? The data is there. Take the next step. CDC researchers across the United States in all different academic institutions. I know where you're at. I know you got pools of data. Start re-examining your data. Hello. Before you send your publications to your journals, re-examine your data and flip it over. That's right. I'm encouraging and I am not demanding, strongly emphasizing every researcher, every research team to reevaluate your data, your health disparities data, your generic health report data. We're almost on 2020. And I know you already have your documents. You're submitting them right now for the 2020 reports in all these public health medical journals. Re-examine your data and start examining that data that's related to each and every specific racial and ethnic population and looking at some positive trends. And ask your question, what is causing those positive trends? And in this particular report, there was actually a crossover in death rates beginning in 2010 when blacks had lower death rates than whites. That is remarkable. Hello. Remarkable. It's earth-shattering. I can't make it any more important. It's that important. So again, this is, and I just want you to reevaluate your reports. And I did this show 12, to show you how easy it is for these reports to report the same type of trends and overlook the most basic issues and not highlight it in your most significant publication, the MMWR Weekly Report. This could have received substantial, much more publicity. CDC publications, your Office of Publications, the people who handle media. I know who you are. I know who you are. That's all I'm going to say. You can get more pub by digging deeper, putting on a more positive spin. Just a little. It won't hurt you. It will help you. You can befriend more populations, researchers of different backgrounds by digging deeper in your data and reporting it slightly different. Objective, but different. Simple as that. So, with that said, I am just perplexed at times on some of these issues. But I have to tell you that we have an obligation. Here we go. An obligation to report the most significant findings and flip over these mainstream reports coming from our mainstream agencies such as CDC. Dig deeper. Look at the positive health disparities data. Report it big time. Share it with all the national publications, news outlets, social media outlets, because that's what I'm going to do with this report. That's exactly what I'm going to do with this report. The Ethnic Health Disparities podcast show will publicize this big time because it's that significant. When you have drastic declines in death, and again, like I say, I take this very personal. You should take it very personal. There's been lives saved in the African American black community because of these declines. Hello. Lives have been saved. Now we need, from 1999 to 2050, now we need to ask the simple question, what positive programs, strategies, issues, behaviors, attitudes, values, beliefs could be changing, is changing in the African American black population? That's the next question. That's the next show. We're going to conjecture about potentially what has changed. Oh my God, what has changed in the African American black communities across the United States, which led to these declines. Simple as that. And the reason why we need to ask these questions, this is happening in other populations. So we need to ask this question, these simple questions from this CDC report. Thank you very much, CDC, for reporting this. We're going to help you. Yes, we're going to help you to further evaluate this particular report, because we know there's many other reports just like this where the good data gets overlooked, bombarded by negative data all the time. But we're going to reevaluate. We're going to highlight this good data and start asking the next step, what's behind these declines? Simple as that. Because it helps each and every one of us. That's right. This is the Ethnic Health Disparities podcast show. My name is Dr. B. And this is podcast show number 12. And we examine racial disparities in age-specific mortality among blacks or African Americans in the United States 1999 to 2015. And we flipped it over. So thank you. Email me any question at all, any questions, any concern. Email me at ejb678@gmail.com. Subscribe to me, iTunes, Spotify, Podbean, YouTube. Keep sending me requests, comments on my Instagram and Twitter account. So thank you so much, and stay tuned, folks. More to come. Peace out, folks. This is Dr. B, having too much fun. Peace out.